Hello, and thank you for joining us today. My name is Jennifer Brown, and I'm the coordinator of the Canadian Obesity Advocacy Network and project lead of the needs assessment phase of the National Obesity Strategy. I'm happy to share with you our findings on the environmental scan of existing disease frameworks and strategies, and how these findings can help move towards creating a national obesity framework. Today, I want to discuss what a national strategy framework is, what already exists, including our needs assessment that we looked at in national and international strategies, including the Canadian Diabetes 360 strategy and the Ireland obesity model of care. And then lastly, we'll put this into practice around how do we actually get started. So the National Obesity Framework is really an overarching policy document that sets the directions and recommendations for stakeholders. Essentially, it's a roadmap. It helps us to identify what the problems are, provide recommendations, set targets, measure outcomes, and evaluate progress. And if we're taking a look at a national obesity strategy around framework goals in Canada, we want to make sure that it includes the goal around transforming the obesity healthcare system in Canada, addressing misconceptions and the assumptions around obesity, creating standards of care that uses clinical practice guidelines across all provinces and territories, helps to guide a person-centered obesity care at all ages and across all jurisdictions in Canada, changes the narrative away from a preventative narrative to more of a treatment and management, including practices and policies. Be ambitious, yet practical, adaptable, and transferable. And we want this to also be passed by the government legislation. So for example, bringing it forward as a private member's bill. And all of this bringing it back to transforming the obesity healthcare system in Canada. Currently, Canada has been a leader in the obesity field, and this was elevated more at an international recognition last year when the Canadian Clinical Practice Guidelines for Obesity were published. The advancements from these guidelines included changes, especially in the definition of obesity, moving away from body mass index and weight and body size to more of a science-based adiposity that impairs health-based approach. And these were the first set of guidelines that addressed weight bias and stigma. They use patient-centered care. And more importantly, they provide treatments that address the root science of obesity. However, there remains a number of barriers when it comes to the access of care and gaps in knowledge that was identified by the 2017 and 2019 obesity report cards. And a lot of this is due to decades of Canadian government policies, both economic and health policies, that are outdated and tend to use more of a narrative that's rooted in the BMI definition of obesity, or using quote unquote healthy weights or weight loss for health narratives. A lot of the Canadian policies that exist currently use a very food and exercise based narrative approach. So healthy eating and physical activity as a narrative around healthy weights. It's very much rooted in individual responsibility and highly focused on prevention rather than addressing any treatment or management. And so as such, we have no standardized national obesity strategy in Canada, which is what led us to take a closer look at what exists in both national and international programs. We see that the Diabetes 360, or the National Diabetes Strategy here in Canada, was just published and just approved in 2021. And so taking a closer look at the Diabetes 360, it initially started back in 1999, and it had created a committee, and there was a framework that was developed in 2001, and essentially in 2005, this developed into different types of frameworks. And in 2013, there was a strategic plan that was created but under the umbrella of a chronic disease prevention umbrella. And so diabetes was really without any type of national strategy pretty much since 2013. And so in 2017, Diabetes Canada put together a multi-stakeholder approach where they brought together experts from healthcare, government, the private sector. They included patients and people with lived experiences, as well as the education community, to really come together to create recommendations for their framework. And it was developed based on the HIV/AIDS model, which was known as the 90-90-90 targets. And the whole purpose was to deliver patient-centered outcomes and be measurable and evaluated. So essentially, the Diabetes 360 was published in 2018, but it was based on four frameworks or four targets. And this is where it came out as Diabetes 360 and included prevention, screening, treatment, and outcomes. Now, initially, when Diabetes Canada was using the HIV model, the 90-90-90 principle, it didn't include prevention. So they added in the prevention target, which was the fourth pillar, making it the whole 360. Now, the document itself includes around 36 recommendations. It's really targeted around saving the healthcare system money. And it does an excellent job of showing how much money the healthcare system can save over 7 years. So you can see here $20 billion over 7 years, so quite lucrative to the government eye. And the purpose of the recommendations also is to work towards setting targets at provincial and territory levels, again, using the framework as a support for systems. So taking a closer look at the Diabetes 360, we see that the prevention itself, the recommendations are that 90% of Canadians live in an environment that preserves wellness and prevents the development of diabetes. That 90% of Canadians are aware of their diabetes status. That 90% of Canadians living with diabetes or pre-diabetes are engaged in appropriate interventions to prevent diabetes and its complications. And lastly, 90% of Canadians engage in interventions that are achieving improved health outcomes. So in June of 2021, Bill C-237 was passed by the government in order to adopt the National Diabetes Framework to become law. So this was a great accomplishment for Diabetes Canada and all those involved. And so we met with members of Diabetes Canada to learn a bit more about how they did this. And I want to share with you some of the things that we learned. Number one is to make sure or they had started off with a very solid plan and a solid vision and identified what the key problems or the key pain points were, either from people living with diabetes or clinicians, educators, researchers, policymakers, but they did a needs assessment and learned what were the key issues in each of these four pillars for those pain points. They conducted a literature review and produced a background paper basically of all these problems. So looking at what diabetes is, the impact it has on health and the economics, the current reality or the state of diabetes in Canada, and then more importantly, the opportunities. So they again adopted the HIV and AIDS 90-90-90 model, and that's how they were developing their framework. They then met with stakeholders and conducted roundtable meetings and again published white paper reports, so they had everything documented. They convened an advisory committee and created working groups that met throughout 2018 that essentially reviewed all of the recommendations and finalized those recommendations in the Diabetes 360 report. And this was used towards the 2019 federal pre-budget. Now, a key point that our interviews brought forward was focusing on the science behind the numbers. The Diabetes 360 did a really great job of pulling out how much money certain interventions can save the healthcare system over the years. And this is really, I think, what helped bring it to the government's attention. Once they had finished their recommendation report, so once that framework was set, they then transitioned into an advocacy mode, and they created an advocacy council. They engaged in stakeholders, and they increased their partner organizations. They really focused on consistent messaging and then training advocates and working with lobbyists, especially lobbying the provincial leaders. So the big message was the key messaging to make sure that those recommendations put forward in the framework was now being put into an advocacy role. They had recruitment from political liaisons, so they had MP Sonia Sidhu sponsor a private member's bill, and this was Bill C-237, and it was brought forward to the report on the Standing Committee for Health as well as the Standing Committee for Finance. And again, it was in June of 2021 that the Canadian government finalized and passed the National Framework for Diabetes. So there's a big congratulations to them. But the Act does require that the Minister of Health develop a national framework, and it needs to make sure it includes an explanation of diabetes, prediabetes. It needs to include how training and education and how the clinical practice guidelines are going to be used, how the framework itself needs to promote research and data collection. It needs to have a knowledge translation component to it. It needs to address inequalities, and it also needs to make sure that the CRA administers a tax credit. Now, interestingly enough, they have 1 year from the date of it being finalized for this framework to be due. So we expect at some point in early 2022 that the Minister of Health will have this framework published. Now, this expanded our assessment internationally to take a look at what's going on across the world. And this brought us to the Republic of Ireland with the obesity model of care. And the obesity model of care was developed by the National Clinical Program for Obesity, and it was set up as a joint initiative between the government's Health and Wellbeing Division and the Royal College of Physicians of Ireland back in 2017. They established working groups that included multidisciplinary members, and they had a number of people using both international and national best practice and guidelines, including the Canadian Clinical Practice Guidelines, and it was published in March of 2021. Now, interestingly, the government was incredibly supportive, and their goal is actually to implement this model of care and have it in practice by 2024. Now, the Ireland's model of care, they have 5 levels of services around obesity model of care, and it's all based on the chronic disease model that they use. So the actual obesity services range from a level 0 up to a level 4, and the framework itself is based on, again, more of a community health promotion standpoint, so that would be level 0. Level 1 is more of your primary care level, so family physicians and primary care providers. Level 2 of obesity model of care is actually more ambulatory care in the community, and these are actually led by dietitian programs throughout Ireland. Level 3 is ambulatory care, but at an acute specialty level, so this would be obesity specialists. And then level 4 is a specialty hospital level around bariatric surgery. Now, what's interesting with their framework is that, again, they base their standards around international clinical guidelines, most of it being based around the Canadian guidelines. And it was mapped out with benchmarks for services at each of these different levels. And they created a business case for funding so that the government could help fund their program. And each level includes, key elements of care that needs to be provided at each of those different services. The training requirements of staff, the actual workload for staff and the number of health professionals, their level of expertise, the services that are actually implemented at each of those levels and the requirements on what the deliverables are, and then what they're going to monitor at a national, regional, and program level. Now, what's interesting with the Ireland's model of care is that each level circulates up or down. So patients are always having access to care. So if somebody no longer requires a level 3, they would either go down or they would go up. But they're never lost to care, which is again a really great model that they've created. So we conducted interviews with them as well, and I want to share with you some of the highlights that we learned from the Ireland's model of care. Number one, they really focused on changing the narrative from prevention, so that eat less, move more, to more of treatment. And I love this quote that Dr. Donald O'Shea, he's the national clinical lead for obesity on this project, and he has a really great quote that reads, "You wouldn't tell somebody with melanoma that has a genetic predisposition to just put on sunscreen and wear a hat. That is offensive. And it is as offensive to tell someone living with obesity to just eat less and move more as their sole part of their treatment." And I think this really resonated, especially with the government policymakers. They also focused a lot on wait times, and they made it public. So they took a look at the wait times in community programs for providers, for specialists, and for surgery, and made it quite public so that there was, again, that need and that voice coming from the public eye. And then they linked the impact of wait times to the severity of those chronic diseases and showed that by not managing obesity, it was putting more of an impact on other chronic diseases and access to care. So again, it really drove home the idea of impacting obesity as a chronic disease and making sure that they had accessible and timely care. The last thing that they really emphasized on how they did all this was having a strong patient and public engagement. So the Irish Coalition for People Living with Obesity and the Association for the Study of Obesity of Ireland, they did a really great job, and a lot of this was modeled after the Canadian Public Engagement Committee and the work that Obesity Canada has done. So they definitely gave kudos to Canada. Now, it's interesting with Ireland's model of care is that they have this national model of care, but they don't have clinical guidelines, and they're actually part of the adaptation pilot program that the clinical practice guidelines is undergoing. So just really unique to see these two perspectives in terms of what's happened nationally and internationally. Now, we also looked at other strategies in our needs assessment, including the Canadian mental health framework, because of the overlap with mental health and obesity. This report or this framework was published initially in 2009, and it basically led way to the publication of the 2012 mental health strategy for Canada, which again was a framework to help with direction and recommendations and measures. And again, there's a lot of overlap from the mental health strategies that we can also use. Internationally, we also found Australia is in the midst of developing an obesity strategy. However, the government of Australia still has a lot of the policies driven towards, or the narrative tends to still be focused on a prevention around food and activity-based narrative of obesity. And so the National Framework for Clinical Obesity Services is, again, trying to advocate to have better supports and management. So lots coming out of Australia that we'll keep an eye on as well. Now, these opportunities are really great in terms of things that we can learn about both of these strategies that we can leverage to put towards creating a Canadian obesity framework. And I want to take a look at some of the overlapping messages that we've heard from these interviews with both of these groups. Some of the highlights that we may want to consider is that we really need to have a united voice and consistent messaging, that we need to know our numbers. So we need to know the prevalence of obesity. Currently, right now, the government surveillance of obesity uses the BMI at a population level approach, and this isn't giving us a full picture based on the clinical practice guidelines definition of obesity, where adipose tissue impairs health. So we need to have a better understanding of what this looks like, and we may need to take a look or explore of how we're going to surveillance this long term. We need to know the current state of programs provincially and territorially, so we need to know what's occurring across Canada. We need to focus on wait times and the economic health impact, so really linking those wait times with money. And we also heard a lot about having political liaisons and making sure that the government is supporting our initiative, so having their voice behind us. And most importantly is for us to align with the government's mandates. As we know, there's a lack of funding right now in Canada, so we really want, this is actually a great opportunity for us to link obesity with some of the current mandates that the government has. So some things that we can consider as we're looking at our framework is the equity, diversity, and inclusion. There's the action plan that the government has put out. Taking a look at stigma, specifically in healthcare. So again, this is something I think Obesity Canada is a leader in, but really bringing our framework and having it aligned with the government's mandates. And making sure that we're including the Truth and Reconciliation Act in everything that we're looking at, and having the voices of the Indigenous populations as part of the framework that we're creating. And then lastly is the chronic disease and integration. So oftentimes we want to look at this as a big tent approach. So whatever we're doing in our recommendations, does it then apply to all the other chronic diseases? Now, this is where we can take that next step. What is the next step for our action teams? And many of you are familiar with the fact that we have 4 action teams. We've realigned these to the education, policy, community, and research action teams. And again, the focus of this is to help achieve the National Obesity Strategy by creating this framework and having each of our action teams aligned with goals and messages, that as we're going through all the projects, making sure that we can have these as publishable papers or position statements, or just publishing these on the website so we have everything documented. And some of the things we can consider as we're in the midst of creating that framework and using some of the strategies that we've learned from this environmental scan is, number one, consider using some of the concepts that the Diabetes 360 group used, especially around the 4 pillars. So addressing key problems at the prevention, the screening, the treatment, or the outcome level. Each of the action teams could be looking at this, and then we could produce background papers. Now, a lot of this groundwork has already been done by Obesity Canada, so it would just be a matter of our action teams kind of digging deeper and looking at how this could impact our recommendations for a framework. We could also use the Diabetes 360, the targets that they use, that 90-90-90 principle, because it's been used in other strategies and it's been effective. So an example could be for obesity, we could recommend that 90% of Canadians live in an environment that preserves wellness and prevents the development of obesity, that 90% of Canadians are aware of their obesity status, 90% of Canadians with obesity are engaged in evidence-based interventions that treat obesity and its complications. And 90% of Canadians engaged in evidence-based interventions are achieving improved health outcomes. So these are some strategies we could consider. We could also conduct roundtable stakeholder meetings and ask those questions around the value of implementing the 360 targets. What does success look like? What would we need to consider if we were looking at these targets? So what projects or actions would we need to look at? We could also prioritize these. Now, this is an example similar to Diabetes 360. I just took a snippet or a screenshot of their recommendations, where they prioritize actions based on their targets. And they set not just the actions, but they set the measures and outcomes on how they were going to achieve these targets. So we could do something very similar. Once we identify what those actions could be for each of the 4 pillars, we could determine, does this address those government priorities? So like I mentioned earlier, the mandates that the government has, do each of those actions align with some of the mandates? And then consider what the short and long-term priorities or projects could be. We could also designate a primary action team to be responsible for that action or that project, and then have co-action teams support them, because again, many of these will overlap. And the last step would be around finalizing recommendations in a national obesity framework. It's an exciting time for all of us as we start to create the framework for the national obesity strategy in Canada, but it's going to take teamwork. It's going to take lots of dedication, patience, but most importantly, it's going to take persistence. I want to thank you for all your time today, and I look forward to the opportunities and all the discussions that this will bring. Thank you again.